ಬ್ರದರು ಶ್ರೀಧರ್ ಚಿನ್ನಿಕಟ್ಟಿ ಅಂತ, ಅವರು ಸ್ವಲ್ಪ ಹೊಟ್ಟೆ ನೋವಿನಿಂದ ಟ್ಯೂಮರ್ ಆಗಿದೆ ಅಂತ ನಮಗೆ ಹೊರತುಪಡಿಸಿದ ನಂತರ ನಾವು ಆಪರೇಷನ್ ಮಾಡಿಗೋಸ್ಕರ ಬೆಂಗಳೂರಿಗೆ ಹೋಗಬೇಕಾಗಿತ್ತು. ಹೋಗಬೇಕಾದಾಗ ವಾಹನದ ಸಮಸ್ಯೆ ಬಂದಾಗ ವಾಹನಗಳನ್ನು ಕೇಳಿದ್ದೀವಿ. ವಾಹನದವರು ನಾವು ಕೊರೋನಾ-19 ಇರೋ ಸಂಬಂಧ ನಾವು ನಿಮ್ಮನ್ನ ಡ್ರಾಪ್ ಮಾಡಿ ಬಂದರೆ ನಮಗೆ 15 ದಿವಸ ಕ್ವಾರಂಟೈನ್ ಹಾಕ್ತಾರ ಅಂತಂದು ಎಲ್ಲರೂ ನಮ್ಮನ್ನ ಬರಲಿಕ್ಕೆ ಯಾರು ಆಸ್ಪದ ಮಾಡಲಿಲ್ಲ. ಹಾಗಾಗಿ ನಾವು ಒಂದು ದೃಢ ನಿರ್ಧಾರದಿಂದ ಬೈಕ್ ತಗೊಂಡೇ ನಾವು ಹೋಗ್ಬಿಡೋಣ ಅಂತ ನಾವು ನಮ್ಮ ಬ್ರದರ್ ಡಿಸೈಡ್ ಮಾಡಿ ಬೆಳಗಿನ ಜಾವ 4:30ಕ್ಕೆ ಬೆಂಗಳೂರಿಗೆ ಬೈಕ್ನಲ್ಲಿ ಹೊರಟು ಬೆಳಿಗ್ಗೆ 11:30ಕ್ಕೆ ಅಪೋಲೋ ಹಾಸ್ಪಿಟಲನ್ನು ತಲುಪಿದ್ದೇವೆ. ಅಪೋಲೋ ಹಾಸ್ಪಿಟಲ್ನಲ್ಲಿ ಮೊದಲೇ ನಾವು ಡಾಕ್ಟರ್ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಿದಂಥ ನರಸಿಂಹಯ್ಯ ಡಾಕ್ಟರು ನಮಗೆ ವಿಶ್ವಾಸದಿಂದ ಬರೋಕ್ಕೆ ಆಹ್ವಾನ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ ನಾವು ಬಂದು ಇವಾಗ ಹಾಸ್ಪಿಟ್ಲಲ್ಲಿ ಯಾವುದೇ ಅಡೆತಡೆ ಇಲ್ಲದೇ ಆಪರೇಷನ್ ಮಾಡಿ ಎಲ್ಲ ನಮ್ಮನ್ನೇ ಇವಾಗ ಕಳಿಸ್ತಾ ಇದ್ದಾರೆ.
See, this patient presented with some symptoms. ನಾನು ದೂರವಾಣಿ ಕರೆಯಲ್ಲಿ ಮಾತಾಡಿದಾಗ when I called him, he presented symptoms to me which were concerning. This patient had symptoms of bowel obstruction. ಅಂತ ಹೇಳಿದ್ರೆ ಊಟ ಸರಾಗವಾಗಿ ಹೋಗೋದು ಕಡಿಮೆ ಆಗಿತ್ತು, ಹೊಟ್ಟೆ ಸ್ವಲ್ಪ ಉಬ್ರವಿತ್ತು, ಮತ್ತು ಆ ಎಂಡೋಸ್ಕೋಪಿ ಅಂತ ಏನು ಹೇಳ್ತೇವೆ ಕೊಲೊನಾಸ್ಕೋಪಿ ಮಾಡಿದಾಗ when we undertook a colonoscopy there was an obstructing tumor. The endoscope couldn't pass through, which told me that he is in an impending obstruction, which more or less becomes an emergency if not attended too soon, and if he lands up with peritonitis that can cause risk to his life. So we allayed the patient's anxiety, we put the information across to the patient, and it was this understanding, it was this rapport which we built, it was this information giving that the patient had, and the risk communication. When this was done, patient was quite happy, keen to travel 450 miles to come to Bangalore despite all the adversities that we have had, the lockdown, difficulty with the movement, as well as the anxiety associated in the hospitals about operating and the suspicious COVID patients that might turn up in the hospitals. But the joy of the whole process is when you're working in a place like Apollo Hospitals, which is a COVID-ready hospital, we feel secure. The reason being, the patients are screened, patients have surveillance, patients have the in-house testing facility for COVID, and they also have isolation and quarantine facilities. And we have an up-to-date, ever-ready ICU dedicated only for COVID patients, apart from the normal standard work that we do. So there is less of a disturbance as well as a lot of confidence within the clinicians that things are taken care of. So it is better that you are in a multi-speciality hospital which is COVID ready, where we know for sure our health is taken care in addition to patient's health. So this patient underwent a seamless procedure, a robotic resection of his colon, and I'm pleased to say that this patient went home on day 4 once the operation was all done. It is a real joy to cater to patients, especially during these difficult times, and in a patient who is anxious and is fearful and who comes from an area that is less served with a better health care than we have in the urban cities. Thank you very much.